Now, one major difference between Medicare and most other health insurance that you might have had in the past is that the drug benefits and the medical and hospital benefits are not connected to each other. So Medicare keeps Part D separate completely. So whether it's included in the Medicare Advantage plan or you're purchasing a Part D drug benefit on your own, these plans are completely separated from the medical side of the benefit. Now with Medicare, they have their own out-of-pocket costs, their own premiums, copays, deductibles, etc. And that's what we're going to go ahead and talk about now. So here are some important facts with Medicare prescription drug plans. Medicare prescription drug plans may have a monthly premium and an annual deductible, but the deductible is usually waived for Tier 1 and sometimes Tier 2 medications. So if you're just taking generic drugs and you see a plan that has a $400 deductible, it might not mean that the deductible applies for your medication. Prescription drug plan benefits work off of the calendar year. So that's January 1st through December 31st. Every single year, it's that cycle. And even if you're signing up for one plan in the middle of the year, it's going to reset in January every year. Each plan does use a formulary. So this is the individual list of drugs that are covered by that particular plan. And some companies even offer multiple plans with different formularies. So it's really important to look at that when comparing options. Now, Part D plans also have different tiers. So as I mentioned before, Tier 1, Tier 2, 3, etc. And each company has different tiers and copays for those tiers. In some cases, the drug might be on a different tier between two different plans. So it might be a Tier 2 medication on one plan, which would be a lower copay or lower cost, and a Tier 3 on another. So again, it's very important to take a look at that when you're comparing. Some plans also have what's called prior authorization and quantity limits. So some drugs require that you and your prescriber to contact the drug plan before you can even fill certain prescriptions. Your prescriber may need to show that drug is medically necessary for the plan to even cover it. Quantity limits just say how much of a medication you can get at a time to cover. So if you've had any prescription drug plans in the past, this is kind of typical. Most companies have a verification process to ensure certain drugs are covered, but you do want to keep an eye out for that with your drug plan. Now, another term you might hear with Medicare Part D is step therapy. That would be where a company would require for you to try one or more similar low-cost drugs before they would even cover a prescribed brand name drug. Now, this takes us to the important enrollment dates. So, since we talked about original Medicare Part D and Medicare Advantage plans, we'll go ahead and talk about that first. You're going to need to get enrolled into original Medicare. So the easiest way to do that would be to go online. And you can also go in person or call Social Security at 1-800-772-1213. If you're a railroad retiree, that number is 877-772-5772. Now, if you're already receiving Social Security benefits before you turn 65, actually, you can relax and sit back because your enrollment will be automatic. Now, you will get a Medicare card in the mail around 3 to 5 months before your 65th birth month. But for the rest of you, the enrollment period is as follows. You have 3 months to enroll prior to your Part B effective date. Then you have the month of your Part B starting, and then 3 months after that month. So the total enrollment period time here for original Medicare, Part D, and or Medicare Advantage plans is a total of 7 months. Now, Medicare supplement plans have a lock-in period of up to 6 months prior, and you have an enrollment period of 6 months after your Part B effective date. And if you miss that 6-month date, you may have to answer to health questions, which could also mean that you have higher premiums. So what's next? Option 1 would be to start calling 30 different places to get rates and information. Or option 2 would be to let us do all of the heavy lifting for you for free. If you're leaning towards option 2, then give us a call at 866-865-4779 or click below and you can choose a date and time here on the calendar and just book an appointment on our calendar right there. And a reminder will be sent to your phone and your email, so make sure to check your email and or text messages for a confirmation. Talk to you soon.